The Lagos State Blood Transfusion Committee, LSBTC, have held the one-day structural training for nurses in the state tagged Train the Trainers. The seminar is part of the Lagos State government and the LSBTC's commitment to promote safety practices during the blood transfusion process. Over 110 nurses, both from the public and private sector, were present at the training to ensure a holistic approach in health service provision. Speaking in an interview with Access 24, the Executive Secretary of LSBTC, Dr. Bodunri Oshukomaya, harped on the essence of the seminar. She expressed hopes that the trained health providers will in turn train others at their various hospitals of service.
Not they would say if the blood transfusion has gone smoothly or not. They are also there to ensure that the blood is actually of the good quality that we expect that it should be transfused. Another thing that will happen during this training is that the nurses here will be inaugurated as safe blood transfusion champions, and that means that they will take the teaching here to their respective facilities to ensure that each facility has and is strengthened a blood transfusion committee, and they will ensure that any vigilance reactions will be reported back to the blood transfusion service. So all in all, we have made them the key sets of people to ensure that the safe blood transfusion practices we have been teaching all healthcare personnel is implemented and well established. So we have over 110 nurses invited here from both the private and public sector, from the federal and the state sector. So we have from the military hospitals too, from the police hospitals, naval referral centers who have been invited. We have people from the secondary healthcare facilities, that's the general hospitals, and the tertiary too. We have from LASO, that's Lagos State University Teaching Hospital, as well as Lagos University Teaching Hospitals. We have from the federal medical centers at Ekpe and at Ebutimetaya. So it covers every facility here. We have over 30 private hospitals invited here, and the nurses that were nominated from these private hospitals range from 1 to 5, depending on how big those private hospitals are.
Other stakeholders like Dr. Oluwatoni Adeyemi, the SSA to the Lagos State Government on Health, reeled out the benefits of the training to both the nurses present, their places of work, the patients under their care, and the Lagos State government as a whole. A consultant hematologist with the Lagos State Teaching Hospital LASUT, Professor Ebele Uche, expressed hopes that after this training, the nurses will be able to recognize blood transfusion reactions, which would prevent a possible complication in the process.
I think this training is actually very important. It's been put together by the Lagos State Blood Transfusion Committee, and then they are training them on how to ensure safe blood transfusion practices. So apart from the blood transfusion committee ensuring that we have blood available, the way in which this blood is administered eventually to the patient to ensure safe practices is actually very important at all our levels of care, secondary and tertiary level of care in particular. And at this training, we have people both from private and from the public sector. We have from the military hospitals. We have from different hospitals represented around Lagos. Lagos State is interested and committed to professional development of all our healthcare workers across cadres. And even as they are partaking in this training, I don't want it to stop here. So even when they go back, because it's the trainers training, so they are meant to go back and impact this knowledge and train other members of staff at their various hospitals to ensure that eventually any blood that is transfused in Lagos State is one that is of good quality and one that is transmitted without any adverse effects as much as possible.
Okay, so the major aim of this training is for the nurses to be able to identify transfusion reactions in their patients, because they are the ones that would usually stay with the patient throughout the transfusion process. The doctor just orders for a transfusion and goes away, but the nurse is the one that is actually on the ward with the patient. And so it's important for the nurses to not just have a mental knowledge of what the transfusion reactions could be, but they should be able to recognize such transfusion reactions, because we know that even though blood transfusion can be a life-saving intervention, it is also fraught with a lot of complications, and a lot of these complications could also lead to death in the patient. And so we want to make our transfusion practice in Lagos State to be as safe as possible, meaning that a patient should never die of a blood transfusion. And so the importance of this training is to be able to train the nurses to recognize transfusion reactions, to train them to know what to do in the case of a transfusion reaction. So when they go back to their various health facilities, they now also would serve as trainers to their colleagues. And so in this way, we can ensure that transfusion practices in Lagos State are safe for the patients.
The theme of the seminar is ensuring safe blood transfusion practices. Lagos residents were also charged to donate blood whenever they can and see it as a life-saving act of kindness.